Good day, everyone. I'm a little late getting on here tonight. Had a struggle going through this ear problem that I'm having. So tomorrow we'll probably talk about maybe some ear questions, maybe some irrigation or something like that. But I am doing a little better. Still using my eardrops, and the pain is the main thing. The pain, and probably when you have an infection, you just feel horrible. So fever and pain are the two things that can get me down. And I did sleep a lot more today. But otherwise, I'm still said, hey, it's late, but I'm gonna come on here and give you your NCLEX tip. NCLEX test tip of the day, your NCLEX question of the day, because it is Test Tip Tuesday. All right, so here's our question. A nurse is providing care to a client with urinary incontinence. So that is your case event. You know who your patient is. It's a patient with urinary incontinence. Now you're going to read a little more to see, well, what's wrong with them other than urinary incontinence? Well, he or she who has an abrasion to the left inner thigh. All right, so they have an abrasion already, and they have left inner thigh, and they have urinary incontinence. All right, so our query is, now we're going to break down the question. The query is, which action should the nurse perform to maintain skin integrity? All right, now when you're breaking down questions, you want to pay attention to key words. And a lot of times that's embedded in the query. This question is not asking you what you're going to do about urinary incontinence. It is asking, what are you going to do about skin integrity? And better yet, how are you going to maintain the skin integrity? So before you look at your questions, a good test tip that I say is just think about, what do you do for skin integrity? What do you do for your patients? If you're a CNA, or if you're an LPN going back for your RN, or if you are a medical assistant, or if you take care of somebody at home, or you do home care, whatever you do, maybe even what you did in clinicals, what were you taught and what do you know about maintaining skin integrity? So some things I think about is I put some cream. You might remember putting a barrier cream on your patients, especially patients who have urinary incontinence or any type of incontinence. If they are urinating or having bowel movements on themselves, a barrier is what you would use to help protect the skin. So that way that barrier doesn't allow the wetness or the moisture to absorb into the skin and keep the skin wet. I think about babies. When I had my little babies, that we would have to have ointment or diaper rash cream. So we would put cream and ointment to prevent diaper rash. Okay, so now you're just going by what you know. Go with what you know. You know something about maintaining skin integrity. You know what you would do for anybody who has urinary incontinence to maintain skin integrity. And they throw in that, okay, this person has an abrasion on his left inner thigh. He already has like a little scrape or scratch, um, you know, could be related to the skin integrity, to the urinary incontinence, but we know that he has some breakdown. This person has some breakdown in their skin. So we want to maintain it. What are we going to do for them? So that might be some of the first things that come to mind. That's what came to mind for me. All right. Now, another thing is breaking down this question. This is a nurse action question. And if you've been studying with me, you know that a nursing action is going to fix the problem, or it's going to prevent a problem. Both of those things together are going to be helpful to your patient. You're also going to keep your patient safe. All right, so I got to do something that's safe to do, that is going to fix the problem. The problem is he has this abrasion, he's got urinary incontinence, but really they're asking us how to maintain skin integrity. In other words, how am I going to prevent him from having further skin breakdown or any skin breakdown? So overall, this is a preventive measure, a nursing action that is going to prevent. All right. Now you go through your options and you use your process of elimination based upon what you know. Okay. Apply antimicrobial ointment. Well, antimicrobial ointment is for preventing or treating an infection. Just like I have this Antimicrobial ear drop. It is treating the infection in my ear. So they don't mention to me this patient has an infection. The focus here, the subject is on skin integrity and how are we going to maintain that. So we can eliminate this because it goes off the chart, off the border, off the direction or the path. We need to stay on the path. Stay on the path that they're asking you about. Get rid of antimicrobial ointment because we're not treating an infection or preventing an infection. B is insert an indwelling catheter. Now, although that might be helpful if a person has urinary incontinence, it's very invasive. And NCLEX likes us to do the least invasive thing. This is a bit invasive, and we usually don't put catheters in just because someone is incontinent. Now, if they're having retention, we may need to do that, but not just for incontinence. Although that does help maintain skin integrity, it's case by case. Some individuals may need that Foley if they have a very extensive wound and we need to keep them dry and they have incontinence. But for this patient, they don't tell us all that. We're just trying to maintain skin integrity. That's a little bit farther beyond the least invasive thing that we can do, which we kind of said here. These are some things we would do. At least we would start here. All right, we get to, so let's go ahead and get rid of B. We get to C, spray the abrasion. So now they focus back on the abrasion, which is part of the case event. Should we spray it with alcohol-free barrier film? I notice here they use this word barrier. And when we're maintaining skin integrity, we talked about cream, barrier cream. At one of the hospitals I worked at, we used to call it EPC, extra protective cream. It was very thick and it did go on the skin very thick, and it created this lather or this barrier to prevent moisture from just sitting on their skin. So this is a good option. We're going to keep this one. I'm going to put a star by it. We get to D, and D says place a gauze dressing on the patient's thigh. Now, although a dressing can somewhat provide a barrier, they're incontinent of urine, and we know that urinary incontinence, well, urine can seep through a dressing. And what happens when patients have dressings and they poop or they pee? Of course, we have to change that dressing. It doesn't really protect the thigh altogether. It's not the best choice. Do we really need a dressing for that thigh abrasion? Well, a dressing just will not protect it from constant moisture. Very few dressings will. Now, there are some dressings that you could probably put some type of Tegaderm film, maybe that doesn't seep through, but probably a little more invasive than just applying a barrier film first. Even though it doesn't go on the inside, we're doing a little bit more. So between these two are good choices, but what is the best action? What are you going to do to prevent this problem? What's the first thing you need to think of doing? We're going to apply the alcohol-free barrier film. All right. So we eliminate D because it's doing a little bit more. We're putting a dressing. The dressing is going to get wet. It's going to hold moisture, whereas the barrier film prevents moisture from getting on the abrasion or on the skin. So that's really what we want. All right, very good. I hope you got that one correct. So if you're wondering about the alcohol-free film, barrier film, it will protect the abrasion from constant moisture as a result of incontinence. The nurse should protect the skin to prevent breakdown. An antimicrobial ointment, we said, will protect from what? Bacteria. Incontinence causes constant moisture, so the abrasion should really be kept dry. A catheter will keep them dry, but it shouldn't be inserted only for the purpose of incontinence. It should not be inserted for that. So we should use other methods to keep the skin and abrasion dry. If we place a gauze, we said again that will not protect it from constant moisture. And so these are some examples of some no sting barrier film. There's a spray here that we can apply, but there's also creams and things that we would use that protect the skin. All right, I hope that helps. I hope you wrote down your test tip for today. Again, nursing actions. Again, NCLEX language. What does certain words mean? You want to write down that term. When you see skin integrity, how do you maintain skin integrity? You provide a barrier for the skin, especially when the skin is moist. Go back and also study your Braden scale. What are the factors that they look at for Braden scale if a patient is at a high risk of developing a bed sore? That will also help you to keep in mind of things that increase the probability of developing a breakdown in their skin integrity. So I hope this helps. I hope you have a wonderful day, and hopefully, God willing, I'll see you back tomorrow with another NCLEX tip. Have a good night.